For those who have the brochure or the program already, I'm sure you would see that we're meant to move into our first session, but we want to make sure that all the speakers for this session are connected because they are joining us from across the globe. While we are trying to make sure they get connected to this program, we would move straight on to the cancer survivor voices. Like I mentioned earlier, this part of the event is a particularly personal one for me, and I can't wait to hear all the stories about the cancer survivors. So, without further ado, could we put our hands together as we welcome the cancer survivors? Please step forward. Thank you. Let's put our hands together for them. I mean, it's not an easy feat going through hell and high water. So please, thank you. Please have a seat. Okay, so I had to specially drag this beautiful, intelligent, amazing woman forward. I'm going to let her do the honors to introduce herself, then you understand why. Thank you.
Thank you very much. Distinguished ladies and gentlemen, allow me to stand on the existing protocol. My name is Tinu Lawal. First, I am a cancer survivor, a breast cancer survivor. 11 years this year. Thank you. I'm also the founder of Atinuke Cancer Foundation in Lagos, and currently the chairman of the Nigerian Cancer Society, Lagos State chapter. This call is quite impromptu, actually. My coming to Abuja too is quite impromptu. I welcome everyone here. And I was just told right now that I'll be moderating this session. So thank you for having me here. Thank you so much. Thank you. I'm sorry about that. I just had to get my briefs. I understand that I'll be taking the session with Andy, and we'll be talking about innovation in cancer care and also what has been going on. I'll just use this opportunity to briefly give you an idea of what has happened in the past 11 years. 2014, I was diagnosed of cancer in Lagos. And this was at a time when cancer was such a stigma in this country. It was so bad that it was actually hushed. It wasn't so easy to tell the next person that you had cancer. And it was a time when there were no equipment to even treat. In Nigeria at that time, I remember we had only one radiotherapy machine working, and that was the one in Luth. The other one that was close to a radiotherapy machine was an Echo Hospital. It was a Cobalt 60, and we all know the difference between the linear accelerator and the Cobalt 60. That's just like, in layman's definition, it's like having the box phone, the old box phone, the one you turn like that, and having an Android phone. We all know that both of them can make calls, but we know what the Android phone can do, as opposed to the box phone. It was at a time when even chemo chairs were not available. It was at a time when manpower was also very short, and even despite the fact that we had oncologists in Luth, they were trying so hard to manage the numbers of patients that we had. My eyes got open to this much because I was diagnosed of cancer. Before then, I was never a sickly person. I hardly fell ill. But because I was diagnosed and I had to do my treatment in Luth, I was able to see a lot of all this, shortcomings and all that. It was at a time when to get, if you were lucky, if you had breast cancer and you find yourself as an HER2 positive patient, to get Herceptin, the drug for cancer, was 1 million naira per dose. And for such a person, she would have to take 18 doses after a chemo and a radiotherapy. It had nothing to do with the treatment. It was just a drug that would continue to keep her. It was at a time when a lot of women could not even tell their husbands because a lot of men left their wives simply because they were diagnosed of cancer. It was a time when cancer was perceived to be a taboo in Nigeria. It was looked at as some form of voodoo or juju from your enemies and all that. So it was a very, very bad time in Nigeria. For me, it was even worse because it was at a time when Ebola was discovered in Nigeria. The last thing I wanted to do at that time was go to the hospital because, of course, the first place we found Ebola was at the hospital. So it was a very difficult time. So now it was, very, very, very intense. So, but we thank God that over time, things have gotten better. As at 2019, three radiotherapy machines were commissioned in Luth by the late President Muhammadu Buhari. May his soul rest in perfect peace. At this point, I would like us to respect him and give just 1 minute silence in his honor. May his soul rest in perfect peace. So, not to waste too much of your time, we'll start the program proper. We would like to talk to the survivors here. Close to my left here is
Linda Butu.
Linda Butu.
Yes.
Mariam Usman Haman.
Hadiza Bello. So we'll start with you, madam. Can you just tell us a bit about your experience with cancer and how it's been so far?
Okay, like I said, my name is Linda. Good morning. Like I said, my name is Linda Butu. It is not an easy journey. I usually, if I'm talking about this, I get so emotional, or you people should take it easy with me. I was diagnosed 2023, around November, and it was not funny. I want to use this opportunity at the same time to thank Dr. Ayuba, because after the whole result came out, they said I was triple negative. But underneath, there was a +1. And she was just circling it, Madam, go and do this, go and do this, go and redo this test. And I actually, what will I say, do what she wanted me to do. And it came out positive. So before it came out, actually, I was being treated triple negative. So because she was saying, if you do this, it's going to be a game changer. And, I did it, and it was now positive.
What was exactly what she said you should do?
She said I should go and do fish tests.
Okay.
Yeah, because the result came out triple negative.
Okay.
And underneath, there was this positive that I already wrote, inconclusive. So she kind of encouraged me to go and do. She said, it's going to cost you, but do this test so that we'll know the two sides.
Where was it you did your treatment?
I started doing my treatment in 2023
Where was this?
in National Hospital.
Hospital. Okay,
That's
thank you.
December 2023. So because I wanted to wait for the results of Dr. Ayuba, but my doctor now said, "Do you want to wait? Start this thing." So I started chemo 23 of December, December 2023. I did 8 chemo, but like I said, I did 4 chemo. That was when the result now came out. Unfortunately, it took a long time because they said that we are not doing the test here in Nigeria. So I had to take it to the
Yes.
results.
Okay.
So I had to do it in a Sin Lab.
Okay.
And it came out, I think, after 2 months. So they changed the course. And like I said, I really want to thank this woman. You know,
Please, can we give her a round of applause? Are
Yes, yes.
you, Dr. Anatu?
Yes, Dr. Anatu. Because I was telling her, say she's the angel that God sent in disguise. Or else they will be treating me triple negative, not knowing I am HER2, you know? So like I said, I did 8 chemotherapy. I finished. It was not easy. Cancer itself, when you hear cancer, there is this thing, you are sentenced to death, you know? And just like she said, you kind of hide it. You don't want anybody to know. For me, it was not easy. Both financially, physically, so many things. You can't think about it. But to God be the glory. I'm here now, I'm standing.
Please, can we give her a round of applause? It's not easy to be here.
I'm here, standing.
After cancer.
Yes, after cancer. I did 8 chemo. I did a surgery. I just finished radiotherapy. It's not up to 3 months. And I still first of all, I did Fisgo. I had to do forceps. Just like she said, you have to do 18 courses of Absetin, which I'm still taking it. But to God be the glory. I'm here.
Thank you very much, Madam. Thank you so much.
Yes.
And by the grace of God, I pray that you continue to survive.
Amen. Thank you.
Can we have?
Good morning, everybody.
Morning.
My name is Mariam Usman Haman. So, my cancer journey started. It started just some weeks to first lockdown. And I've been battling with it for like 4 months, 4 years. I refused to come to hospital. I even traveled far away to India to get a herbal medicine to cure my cancer, but it didn't. It even got worse. So God helps me. My husband says, enough is enough of this herbal, you are running from chemo. You have to face this chemo. So we went to the hospital and I was diagnosed with triple negative. I started the...
Please, can we give her a round of applause? Madam, it's okay. We're happy that you're here and you're speaking before us.
I started the treatment. I took some chemo, and then later they do mastectomy on me, on the left breast. I did another chemo, and I did radiation. So immediately after finishing all this journey for the triple negative, 2 months later, I had another lump in the left breast. So that lump was diagnosed as HER2 positive. So I started the journey fresh again, fresh journey, which is more expensive, more emotional, because I thought I am through with the other treatment of cancer. So I started it afresh. Even my doctor, he was very, very it's not easy with him. He said, you are now going backward again. This treatment of this one is more curious than that one, but you will be better. And I believe in God, because I know that God has been with me since when I refused to do the chemo. He was there and he's there. So he took care of me through this journey up till now. And now I am on Herceptin, though I'm supposed to take a first go injection, but I couldn't afford it. So I go for Herceptin, which with the help of the CHF, I've been getting little money to support myself with it, and then my family, friends have been helping me, even though everybody is exhausted. Cancer is not an easy thing to go through with. Cancer, you are a coward.
Please, can we give her a round of applause again?
Cancer is a coward.
It's okay, madam.
He will attack you cowardly, but the oncologists, may God bless them. May God bless our doctors, because they have really tried to catch cancer wherever he is. They will catch and deal with him. That is my greatest respect for the doctors. I thank God for Allah that I'm alive today and still facing the cancer, but alhamdulillah.
Thank you very much, madam. Thanks very much. That was a very emotional one for her, and I pray that you get relief very, very soon.
Good morning,
Before we
all.
go on, sorry, madam, I would like to use this opportunity to recognize the presence of the president of the Nigerian Cancer Society, Professor Abidemi Omonisi, who just walked in. Thank you. So you can go on, ma'am.
Okay, good morning, all.
Morning.
By name, Architect Hadiza Belleiro, former PAMSEC with Taraba State Government, and the founder of Farmers Cancer Foundation. My journey started 2014, September. Just in the night. Before that, I don't think I ever know something like cancer, or never had something about it. Maybe I used to see it, but I can never remember. Until one night, woke up and see myself in blood. Quickly, I went
What
to
kind of cancer was it, ma'am?
cancer of the cervical cancer.
Okay.
Then I went to meet my friend, a doctor. Look at her here. Then I told her my story. The first thing she said, I hope it's not what I'm thinking. I said, what are you thinking of? Then she quickly changed the topic. No, I will send you to a gynecologist. He will examine you and he will tell you. And she gave me a note. I went to the gynecologist. He attended to me that day, asked me for the test. Immediately, he started examining. He said, do you know you have cancer? Then I said, what is cancer? I just quickly stood up, sat down on the, what is the cancer? He said, you don't know. I said, I don't know. He said, you have cancer. I hope it has no gone far. I said, what is cancer? He said, madam, then I said, what can we do to remove it? How can I cure it? He said, man, if you're lucky, it didn't go far, you can, just with surgery, you can get out of it. But let me give you some paper. Go to the lab and have some tests. He gave me, I went, but my mind was not there, so I quickly rushed to my husband's office. When he saw me, I have never been to his office. He knew that something was wrong. So he excused everybody, sat down with him. He said, what is the matter? They said, tell him that. They say I have cancer. He said, cancer? He said, no, I don't believe it. Just get it, let's go to Abuja. So he called his doctor and a friend, a cardiologist, that this is what is happening, but it's bringing me. I said, okay. We went, then he introduced me to one of his friends, a gynecologist. Went to the clinic. The problem we have here, going to the normal routine of clinic, they waste so much time. I went there, said, I did this. I said, look, doctor, they say if I didn't get this thing done, it will spread. Please do me something. Why can't this doctor don't have a private hospital? He said he has. Okay, let me go to the private hospital so that he can tell to me. They say by the time I waste time, the thing will spread. They called the doctor. They said this is what I said. He said okay. They booked me to his clinic. I went. Then he told me that the first thing they're going to do for me is just surgery to get this thing out of. Quickly, I agreed. It was after the surgery. I said the tumor is there. But he didn't tell me. He just called my husband that if you have money, send this woman abroad for treatment because the tumor is still there. So my husband didn't know how to share it to me. He just suggested that the doctor said, you are okay, but you need to go to make sure that you are completely okay. I told him, they removed all these things and they're saying I should go in. I'm not going anywhere. I said, no. He persisted, with the help of my friend, a doctor. After so many, I agreed to go. I went to Dubai. And at that time, there's only one hospital that non-residents can use for treatment, and that is American Hospital in Dubai. But I didn't know. When we went to the Dubai hospital, I told her about myself. They said, okay, I have to go to an hospital. That's why they treat cancer. We went there. After spending so much, then they said, no, I'm not. Are you a resident here? I said, no. They said, no, we cannot treat you. I have to go back to her. Then she told me that, look, do you have money? We don't have any hospital that can treat you. Do you have insurance? I said, I don't know. I don't have. I don't stay here. I stay in Nigeria. It's okay. She called Dr. Salim in American Hospital. I have a patient for you. Can she come? He said, yes. Going there. But still in my mind, I believe I don't have it. Because they did the surgery and everything was removed. That was my belief. So I went. He looked at me and said, okay. Adiza, you are going to go for PET scan. We're going to do MRI and all these things. We have to find out that you are okay. And it has to be done quickly because we wasted so much time going everywhere. I said, I want to know if this thing is being localized in one space. I said, okay, sir. And they went, we had the PET scan. Normally, it takes 2 days for the result to be ready. But immediately after the scan, he went to check the films and all this thing. He quickly came running. These are the good news. It's been still localized. I said, what is a localizer? He said, the tumor is in one place. I said, which tumor, sir? The cancer. It was then that I had to break down. And I was alone there. They gave me to have to go to the pharmacy to take something for tests and all this thing. I just came to the reception, sat down, tears going afterwards. Then suddenly one Filipino came beside me, sat down. Hello, how are you? I said, fine. Why are you crying? I told her that they say I have cancer. Is that why you are crying? Because they say you have cancer. No, you don't have it. What did they say you should do? I said I should go to, do you know where the pharmacist is? I said, I don't know. Come, let's go. She took me there. She went, as we were going, she started talking, but I was not even hearing what she's saying. She talked to me. She went and did all the procedure. I gave her the money, she paid, she brought me back. Then she sat me down. He said, look, 5 years ago, I was also diagnosed with cancer of the colon. At that time, I thought the whole world was coming to an end. But see me today here. I'm okay. I want you to have that faith in you. You don't have cancer and you get out of it. Don't cry. Stand firm. Stand strong. You will defeat it. And at that time, immediately after she finished talking to me, I became strong. He said, look, we have an organization all over the world. We normally go around to the hospital. When we see a first-timer like you, we sit down, talk to them, tell us our stories so that we get you strong. And I want you to join this men after the whole thing. After that, I will continue calling to you and I will continue praying with you. I will tell my husband, my family will all pray for you. So when I went, I met the doctor. I saw him. Then in their own system, the nurse will call you, they talk to you. She called me, say, Hadiza. I say, yes. I know you have a husband. I say, you have children. I say, yes. So what I want you to do now is forget about that husband, forget about those children, and face this thing, because they don't go together. By the time you are thinking of your family, the procedure of curing you will be hard, because this thing wants you to be given that attention and face it squarely. We're here for you, and you'll be fine. The doctor said you're going to go, they're going to do a radical approach for you. You'll be doing chemo weekly, then every day, except this weekend, you'll be doing the radiation. And you're going to have 5 courses of chemo and 25 courses of radiation. Is that okay with you? I said, do you have any other elements apart from that? I said, no. Do you have BP? I said, no. Diabetes? No. God said, I said, no. You are okay. What time will you choose to be coming here for the radiation? I said, I'm here in this town just because of this, and so I don't have any. Even if you say 6 o'clock, I'm coming 6 o'clock. I said, no, we'll open 8:30. We'll put you 8:30. I said, okay. And that was when we started the journey. My first chemo, it was always on Wednesdays. And I have my radiation because their weekend is Friday and Saturday. So Sunday is the beginning of the week. So I have Sunday, Monday, Tuesday, Wednesday, Thursday of the week of radiation. Then the chemo on Wednesday only. The first chemo was okay. I didn't feel anything. The second one was okay, but I started feeling some funny things. The third one was Kai. It was then it had started hitting me. So when I get to the hospital, Hadiza, how are you today? I said, I'm not fine. So what is the matter? He said, Kai, I don't understand what I'm feeling. So okay, go and talk to a doctor. That and Dr. Lily. I said, doctor, today I'm not feeling fine. Can I take something? He said, no, Hadiza, don't take anything. Just go to the town, see beautiful things, and you'll be okay. I said, no, I won't be okay today. I want to. Even Panadol. Said, no, Hadiza, don't take Panadol. When I insisted, do you know this Panadol? You're already exposed to chemicals in you. This Panadol that you take, it will destroy 70%, destroy you, then only 30% will work. I said, no, let me just take today. It's okay, just take 2. I said, I'm not feeling fine. He said, I know, Hadiza. So I took 2 Panadol. As she said, I tried and went to that Dera, went around. After a small time, became so weak, I have to enter taxi to go back. But the 4th chemo, the 4th one, that day was too bad. Because, in fact, I thought that would be my end of the story. I went home after the first 2 days to sit down, slide down problem, stand up problem. So I wanted to call, just pick my phone to call my husband, ask for forgiveness that I cannot make it again because of the way I'm feeling. I picked my phone, wanted to call him, then I got a call from my brother. when the way I sound, I said, Hadiza, what is wrong with you today? You are looking, your voice. I said, no, I'm just from asleep. I said, no, Hadiza, we are all with you. We are praying for you. You will be fine. You are okay. So don't think about it. You are going to get out of it. He talked to me after small time. Then I look and say, Hadiza, you are a lucky girl. You have the opportunity to come and get the best treatment. And look at them, people are praying for you to recover. Then I just threw my phone. From there, just took me off. So when I went for the last one, the 5th one, the doctor saw me. Everybody saw me the way I was looking. Said, all the nurses, the oncologist nurses, said, no, Hadiza, today is the last time, you'll be okay, what? I said, but the way I'm feeling, he said, don't worry, Hadiza. When the doctor came and saw me, said, let them go and do some tests for you. When they win the test, he came back running. Hadiza, don't do this thing today. If you take this thing today, you are going to die.
Who said that to you?
The doctor, the oncologist. Your immune system has gone down completely. I used to be low BP, but that day my BP was around 149 by 110 or 120. He said, Hadiza, don't take this thing today. Then I was sad. I said, well, I want to finish this thing now and rest. And now he's telling me, so doctor, when will I come back for this again? He said, no, you are okay with the focus. I said, okay, sir. You said I'm going to get 5, and you are telling me this, I'm okay. He said, no, you are okay, Hadiza. Don't worry. Some people, man, just 3, of course. So just go and finish up your radiology. You'll be okay, you're okay. So I've become relieved. Went back to my consultant radiologist, Salim. Dr. Salim said, doctor, this is what the doctor told me. He said, yes, you're okay, Hadiza. After you finish this one, I will send you to Qatar for brachytherapy. I said, again, sir? He said, yes. I want to make sure that the whole tumor disappears. So you have to go for brachytherapy. That it is just introduced newly. And there are 2 types, the needle type and the blunt type. But we don't do the needle type, it's the most efficient one. You have to go to Qatar. I said, I don't know anybody there. He said, don't worry, I will talk to you. So he sent my result to the consultant there. On getting there, the doctor said, the needle type, because the tumor is lying directly underneath my intestine. During the choking the time, the needle type, it might punctured my intestine. So you have to go for the blunt type. And thank God the blunt type is in Abu Dhabi. And that I have to do 2 courses of that.
Thank you very much, madam. We've all heard the stories of all the patients, of all the survivors, and we all know that cancer is a bully. With this kind of stories, nobody ever wishes to have cancer. And we all know that since that time, between that time that she had a treatment and now, we know that some innovations have actually taken place. Thank God we can all sit before you today and talk to you easily and, tell you about our journeys. Before I go on, I would like Andy, please can you pass that? Do you have any comments to make?
I'm silenced, okay? and that's not an often thing, because I'm here in power, strength, and positivity. So a big round of applause.
Okay. Thank you very much.
Thank you.
Do we have questions from the audience? Do we have contributions? Okay. I see Dr. Adamu Usman raising his hand.
The tallest guy in the room. The tallest guy in the room is going to talk now. Thank you. Thank you very much.
Sorry, before he goes on, Dr. Adamu was the past president of the Nigerian Cancer Society. And yes, right now we have, there's a lot, I'm sure there's a lot he has to say about this innovations.
Yeah, thank you very much, our Lagos chair, distinguished personalities in this room, our champions, I salute you. My name is Dr. Adamu Al-Hassan Umar. like Tinu said, the immediate past president, sorry, sir, of the Nigerian Cancer Society. And I currently chair the Oncology and Cancer Care Committee of the Nigerian Medical Association. I want to salute the four of you for truly bringing out what you have inside. It was very emotional for us listening to you. And it was not surprising to us when emotions go high when telling stories like this. Now, there are two things I want to just highlight quickly. The first is that the power of synergy, the power of holistic cancer care is the reason why we are here in this room today. And during the opening remarks by Andy, he made mention of the fact that everybody in this room is a stakeholder if we truly want to get it right. Listening to the first two panelists talk about their experience with their clinicians, with their oncologists. By the way, they are very lucky to have gotten access to clinical and radiation oncologists that we have very, very few in Nigeria. In my state, where I come from, the entire state, there is no single clinical and radiation oncologist. And so in many states in Nigeria. So you people are lucky. And I'm happy with the kind of testimony they gave about their clinicians. And that is what we are talking about. When we want to truly cure cancer, it has to be all-encompassing. It starts with the patient and ends with the patient. Because palliative care is as equally important as the chemotherapy we are talking about. Because if care is not taken, if psychologically you are not balanced as a cancer patient, even the chemotherapy may not work. So I salute your courage for telling your stories. And I want to encourage you. This is the reason why we are having this ecosystem. So that we continue to work together. So that we continue to rub ideas. So that there will be very smooth interchange between the patient and the doctor. When Hajia Bintu, Linda was talking about Dr. Hannatu, I can easily relate because I know Dr. Hannatu. I know how compassionate she is. I know the empathy she has and all that. And so truly, that is not a true reflection of what is obtainable in other clients. And this is the reason why we all need to come and sit together to talk about this, so that every doctor will be a reason for a cancer patient to smile. Every nurse should be a reason for a cancer patient to smile. Every pharmacist, don't just think you are a pharmacist that you're just dispensing the drugs.
Can you give him a round of applause for that?
So that is that. Lastly, I want to talk about Hajia Hadiza's story. Hajia Hadiza is lucky. She is lucky because in a country with over 8% of the population paying for healthcare out of their pocket, she's very lucky, despite the advanced stage of her disease, to have gotten 5-star level of care. That is not the case for many Nigerians, particularly for her own type of cancer, cervical cancer. Why don't we have plenty cervical cancer survivors nowadays? Reason is simple. They present late and they die. So I'm happy this ecosystem is taking place, and I'm happy all the stakeholders are coming together, particularly the National Health Insurance Agency. Without universal health coverage, we can never talk about holistic cancer care. NHIS Act was amended in 2022, making insurance compulsory on all Nigerians. But as we speak here today, less than 5% of Nigerians have insurance cover. So let's continue this discussion. Let's advance this discussion. I'm happy the chairman of the board of NHI is going to be here later today, and I'm sure some other people we will still bring this to the table so that let it be re-echoed in the minds of the policymakers. For us to address cancer care, we need to make treatment affordable, accessible, and available for everybody, and particularly the early stage prevention, early detection, and what have you. So once again, Andy, Tinu, I join others to salute the courage of these champions for coming forward to tell their stories. And please, let's continue with these discussions. Thank you very much.
Okay, I can see the president of the Nigerian Cancer Society also raised his hand, so please can we?
Yeah, thank you, everyone. Let me start by abiding by the already established protocol. Thank you very much, Andy, for agreeing to come to Nigeria, and thank you for creating this platform for us. I must thank all our survivors for their various presentation. Well, my sincere apology for coming late. I'm sure Nigerians are aware that we lost our dear past president, President Muhammadu Buhari, somebody that have done a lot in the cancer space in the country. Without him, I'm sure he will not be here today. He was the one that signed to law our first cancer institute in this country. And that bill has been roaming about National Assembly for many years. But because of his commitment to improving cancer care in this country, he signed the bill into law and immediately appointed the pioneer Director General, and also ensured that that institute is well funded. So without him, obviously speaking, we'll still be living 10 years.
I'll give him a round of applause
So
again.
we must be part of the funeral. Obviously, not only that, he also established the current, I'm sure they're talking about National Cancer Aid Fund. It was only his tenure that he initiated that. Millions of, almost billions of naira was, created in CBN, and patient whoever said she benefited from it, and several things that he has done, supported our bill, to participate and also aspire, to push forward Her Excellency Dr. Zina Bagudo, for the position of UICC elect, personally signed that letter endorsing our candidature. So he has done a lot, and things like this, we are part of his funeral, and that's why we are late here. So I'm happy that the Chair Lagos have asked us to observe his minister silent to remember him. Then secondly, we are hosting a delegation from American Cancer Society next week. They are coming to meet with us in the country because we want to establish a bilateral collaboration between Nigeria Cancer Society and American Society. So we are busy preparing to host them. So let me thank you for your various contributions, and also to see one or two things. Yes, I agree with you absolutely. Funding of cancer in this country is extremely very expensive. From point of diagnosis, I'm a pathology primarily, so I make diagnosis of cancer. So we are the center of cancer diagnosis. From diagnosis to the point of stabilization, it will cost a breast cancer patient 22 million. That is a lot. How many people can afford 22 million in this country? 22 million. That is the estimate. So that is the problem. Very expensive. Rightly captured. Many of the patients pay out of pocket. There are little support. The only support from government, the National Cancer Aid Fund, which is also good. But in addressing that, we have taken that as a challenge. The Nigerian Cancer Society, next week, Friday, the Honorable Minister for State for Health will be flagging off, launching our committee. We are making a bold move to raise 100 billion to support cancer survivors in this country. Because government alone cannot do it. Government have a support, but they cannot do it alone. We've seen what American society is doing all over the world. We think that we also have the means and the wins to get that done. So with that launch, many people are keen to that project. Ours will be covering all cancers, not the 5 that the federal government is covering now, in all cancers. And then we have independent body that will govern, that scheme. As the president, I have no access to that fund. There are people from private sector to ensure transparency, to ensure honesty, and to ensure that it's get to people that benefited. The other issue of turnaround time is also a problem. The waiting list in the clinic is very long. Why? Because of the current migration of medical personnel. In Nigeria, we have 36 states in this country, excluding Federal Capital Territory, Abuja. Out of that 36 states, we only have oncology in 16 states. Sorry, there is no oncology in 16 states in the country. So that what happened to the citizens of those states? 16. No clinical radiation oncology in those states. In fact, the doctor-patient ratio now is 1 doctor to 10,000 patients. against the WHO recommendation of 1 doctor to 200. Why? Because Nigerian doctors are highly, sought out from the country. We are well trained, and people migrate. UK, for example, a politician go to UK. Most of the doctors that treat, people in the UK, they are Nigerians. I can count about 5 major cancer institutes in the US. That is that the head of that cancer institute are Nigerians. 5 major in the US. Nigerians. So Nigerian doctors are well, trained. Migration, well sought out from the country. You could see Saudi Arabia, all those countries coming to Abuja to recruit doctors from there. So that is the problem. But the federal government is addressing that, trying to bridge the gap. So the clinic, the waiting time continue to increase. Pathology patient issue is also a problem, and that is what we are talking about. So that is some of the problems that we are facing. And lastly, because of time, the communication between the national and the sub-national. The truth is that federal government have done a lot in improving cancer outcome in this country. Where we have problem, I can tell you, and I've said it in many forums, is with the sub-national, with the governors. Many of the governors have poor attitude, bad posture to cancer control in the country, as if, they are immune to cancer. And I mentioned it at their forum in Lagos, that one of you died of cancer last year. So if a governor could die of cancer, we think that should send a strong signal to them that they should take this cancer very serious. But many of them, as if there's not what people talking about. But those are the issues that we are treating nationally. The better days ahead, with the cooperation of the federal government, with CSO and civil society, we hope that things will get better. Thank you.
Thank you very much, sir. Thank you.
Okay. No. Yeah. Okay. No. Thank you.
Thank
okay.
you very much.
A big round of standing applause for these fantastic speakers. Please, stand. Thank you. Your voice is heard. Thank you. Thank you.